This meeting is being recorded.
Okay, so today I'm just going to give a really brief overview of where we are with COVID, talk a little bit about our hepatitis A situation, and just mention STI Awareness Week. So if we look at where we are with COVID right now, we're in a good place. You're going to see that we've had fewer than 60 new cases reported in this past week. So that's just wonderful news. Now, it is important for us to remember that those are underreported data, as we're not taking into account people who test at home. But overall, clearly our COVID-19 activity is very low. We're also seeing that in our hospitals, where we only currently have one Roanoke City, Alleghany resident in our hospital systems. So that's wonderful news. Our death count does continue to go up. That's not unexpected, as we know that unfortunately our mortality there's a significant lag. So it is overall, we are where we hope to be as we head into this wonderful spring, or as we are in spring. Much lower levels of COVID activity, and hopefully we can keep it up. Now, one of the things that all of us in public health, and I'm sure many of you have been looking at, is the BA2, and CDC just released its weekly report on the proportions of variants. And currently region 3, which includes Virginia, we're at about 85% of those strains that are being tested are identified as BA2. So we would have expected that if we were going to see a significant surge associated with BA2, that we would have started to see it by now. That said, we know that there are other areas in the country, other areas even in Virginia, that are starting to see increases. We have not yet seen that, and we'll keep you informed if anything changes. So that's an overview of our COVID-19 situation. To summarize, we were at very low levels of activity right now, really record low hospitalizations with only one person in the hospital right now. So that's wonderful news, and hopefully we can keep it that way. With respect to our hepatitis A outbreak, unfortunately, we continue to see cases of hepatitis A. We currently have a case count of 46 cases of hepatitis A just in the first quarter of this year. And as I've said in the past, we typically would see 2 to 5 cases in any given year. So we do have an ongoing hepatitis A outbreak. About just over 80% of the cases are identified in individuals who use substances, who have substance use disorder. About 70% of the cases are in Roanoke City, and about 70% of the cases are in individuals between the ages of 30 and 49. So that hopefully will help people recognize that if they're in a risk group, that it really is important to get a hepatitis A vaccine. Hepatitis A is a vaccine preventable disease, and it is also preventable by common hand hygiene and making sure that we do proper food preparation. So that's the overview of our hepatitis A situation. Of course, I'll take any questions in a couple of minutes. And the last thing I wanted to note for this bi-weekly update is just that it is STI, Sexually Transmitted and Infectious Disease Awareness Week. And it's really important for us to recognize that prior to the pandemic, we were seeing significant increases in gonorrhea, chlamydia, syphilis. It's a little bit hard to know how to interpret the data over the last couple of years because a lot of people didn't seek care, and we know that people deferred care. Looking at the first quarter of 2022, we look about to be on track at the higher than previously described level of STI disease activity if we compare where that trajectory was going prior to the pandemic. So we're not seeing huge increases over the last 2 years, but we're continuing to see a higher level than we saw 10 years ago, for example. Where we are seeing significant increases is in syphilis. Syphilis is treatable. We need to make sure that anyone who is at risk of STI knows that we have our services available. One, we need to talk about it. We need to take away the stigma. STIs are infectious diseases. They're overwhelmingly treatable, and most are curable. So we want people to be aware, get tested, get treated. And here at the Roanoke City Alleghany Health Districts, we have testing and treatment opportunities at every one of our office locations. So with that, I will open it up for questions. I'm looking at the chat.
Hey, Dr. Morrow, it's Leanna. How are you?
I'm doing well, thank you.
Good. As it relates to kind of reducing, talking about testing for STIs and reducing some of the stigma and maybe some of the fear for people, if you could just walk people through the process of if they wanted to get tested, what would be the first step, and just talk about, I guess the discretion and that they would find, going into an office, just walk them through the process in case maybe they need to go and they're afraid to, and just kind of opening the awareness about the process, I guess.
Well, thanks for that question, Leanna. I think that the first thing is that it's really important for people to know that wherever you go, healthcare providers are going to keep your information confidential. It's such an important part of building trust, and it's the law. And so people, first of all, shouldn't be embarrassed. Being embarrassed can prevent you from getting treatment, and we need people to get treated. These are infectious diseases that are transmissible. So we want to make sure that if you are engaging in any behavior that you feel might put you at risk of having an STI, come and see us. There's no judgment. We'll test you, we'll treat you if that's indicated, and we'll do so in a caring, non-judgmental way. And that's true, I think, for all healthcare providers. It's all healthcare professionals. Our job is to treat people with care. And one of the things that's really challenging about a lot of our STIs is that they may be asymptomatic. And so people who have them may not even have any symptoms. So if you're at risk for STIs, again, engaging in behavior that puts you at increased risk, make sure that you talk with a healthcare provider and a healthcare professional, and they'll go through the specific process for you. A lot of testing now is done through urine tests, so it doesn't have to be anything that's scary. But of course, that'll be a decision that's made with the healthcare professional. So the most important thing is, if you have any reason to believe that you have an STI, talk to your doctor, your nurse practitioner, your PA. Come to the health department. We can screen you, we can test you, and we can definitely treat you. See, there are a couple of questions in the chat. Let me pull those up. Sorry. So Christy's putting our contact information. Thank you, Christy. Why is there a higher risk of hepatitis A in the substance use community? So, that's a great question. What we know, if we look at the epidemiology of hepatitis A, again, is a vaccine preventable disease. It is transmitted through the fecal oral route, meaning that it's a GI infection, it involves the liver, and the virus is shed through the stool. And so what can happen in people who are using substances is that there might be a lot of community action around the substances. In other words, people congregate, they may not have access to sinks where they're congregating, they may share food, they may share equipment, they may engage in other behaviors that involve transmission of bodily fluids. So there may be sexual activity, which can also be a risk factor for hepatitis A. And so there are lots of different ways. And one of the things that we are concerned about is that some of our individuals who use specifically injection drugs may also be experiencing homelessness. And if you're unhoused, having access to hand hygiene, sinks, any place to really wash your hands well can be profoundly limiting if you don't have a place to live. And so that might be part of the contribution. If we look over the last 10 years of hepatitis A is disproportionately being seen in individuals who are incarcerated and in individuals who use injection drugs. So we really encourage anyone who is at risk for hepatitis A or who just wants to protect themselves against a vaccine preventable disease to contact us, and we can certainly arrange to get them vaccinated. Looking at some of the recent spikes in places like Philadelphia, are we testing enough people? So that's a great question. Has our testing gone down? Is that why we're not seeing it? We look at a lot of different indicators. So looking at our hospitalizations is a really important way for us to measure the disease activity in our community. We also look at something called syndromic surveillance, where we're looking at influenza-like illness, people who present to the emergency departments. In our area, all of our indicators are showing that we have very low burden of COVID-19 right now. We all know that that can change next week, but right now we have low levels. Oh, I should also add that we do, in Virginia, we also do wastewater surveillance. So there are lots and lots of different indicators that we look at to get a measure of how much COVID-19 disease activity there is. And all of our indicators are consistently showing that at this point in time, COVID-19 activity is low. Do we think that low levels of testing may be contributing to a very low number, only 56 new cases in the last week? Yes, and there are probably people who tested positive, who did a home test, and we'll never find out about that. But we've gotten away from that individual testing, and we're looking at all of these other parameters, all of these other health indicators. And I'm confident that with all of the health indicators that we're looking at, that our low numbers represent truly low COVID-19 activity for the moment. So I hope that answered that question. Yeah, some major cities and colleges are putting mask mandates back in place because of the variants. Is there any guidance that VDH is going to do that? If city schools should go back, if restrictions come back. At this point, we're not looking at that. I think it's always important for us to be humble with this pandemic. It has surprised us so often. At this point, I don't think that there's any consideration of that for Virginia, certainly not in the Roanoke City, Alleghany health districts, which is really all I can speak to. And our low levels of disease activity that's a good indication that it's not appropriate or necessary at this time. That being said, we know that the CDC community levels are out there with the intention of helping guide municipalities to make decisions at that local level. And I think that should our disease level change, then we'll have to reassess. But at this point, I just don't see it. I do believe that we might go up a little bit with the BA2, but we haven't yet, and hopefully we'll stay that way. One thing I do want to implore people, and we've put some messaging on our Facebook page, is there are people who are choosing to continue to wear masks. And if I'm in a crowded public place, I still wear a mask. You've all heard me say this before. I live with my 84-year-old mother. I will protect myself by wearing a mask to protect her, because even though she's fully vaccinated, I know that if she were to get COVID, she would still be at risk of severe disease given her age. So it's really important for us to respect everybody's choices when it comes to masking. I don't anticipate that we'll have mask mandates now that we know so much more about it, now that we have lots of other tools available to us, including, most importantly, vaccination and medications that are now available. I don't think we'll go back to a mandate, but never say never with COVID pandemic. And I just implore people to be kind. If you see someone wearing a mask, we don't know what's happening in that person's family. We don't know if they're immunocompromised. We just need to embrace that they are taking action to protect themselves, and that's a wonderful thing. Easter this weekend, many people and families should gather. Should people take precautions even with this low number case count? I think that that's going to really be an individual risk assessment for every family. I think that if there is a family who has someone in their family who's older, who's immunocompromised, a young infant who is too young to be vaccinated, I think that they might want to take more precautions than a family of very young, healthy people who are all fully vaccinated. That's really going to be an individual decision. I think that it is important for us to know that COVID activity, yes, we are at low levels, but it's still here. And if we have people who are at risk, we hopefully can work collectively to help them stay COVID free. And I'll just, I'll just say for me personally, I don't necessarily wear my mask except when I'm in crowded places, but I still like to keep a bit more distance between myself and others than I used to. And that's a personal choice. And I think that everybody at this point in the pandemic, we all have the information that we need to make the best choices for ourselves. So I hope that answers that question. It's really about making sure everyone's educated and making the best choices for themselves and their families.
Dr. Morrow, if you could just reiterate for the diseases like hepatitis A that you're seeing, particularly in communities that may be facing greater instances of homelessness, and how are you working to reach, how's the health district working to reach people that you might not otherwise typically be able to reach? How are you trying to reach the houseless population to assist them with getting the care that they need and meeting them where they are and their vaccinations?
Yeah, thank you so much for asking that question. We've been really fortunate to have, over the last couple of years, built our community partnerships. And I know I've said this before, I don't want to overplay benefits of having a pandemic, because overall it's been an extraordinarily devastating 2 years. Over those 2 years, we've been able to build really remarkable partnerships. So we have been consistently partnering with our community-based organizations who work with individuals who have developed trust with individuals who are at higher risk for hepatitis A. And we've been holding vaccine clinics, vaccine events with them in places where they serve the population that's at greatest risk for hepatitis A at this time. So we're working with our community partners hand in hand, doing vaccine clinics, doing outreach for education. As examples, working with the drop-in centers, working with Virginia Harm Reduction, and working with our HAT team, the homeless assistance team. I think I got that name wrong, but we've been working with all of those organizations who really know the community best, and the community trusts them. And so it's really important to us to partner with people who are trusted, and that we work to gain and earn trust in those partnerships.
All right, hearing no further questions, thank you all very much. I will get this video ready for you and get it back out via a Dropbox link. And I hope you all have a wonderful rest of your day. Thank you.
Thanks, everyone.